Hey, my name is Alexandra and I'm filming this video for Module 2 discussing contraceptive history with a patient. So for me, I really like to just sit down with the patient and just talk to them and try to make them as comfortable as possible. Like I'm talking to like one of my friends or somebody that I've known for a really long time. So this is hopefully how the interview would go. Hi, so my name is Alex and I'm going to be your nurse practitioner today. And then I see that you're here because your birth control pill isn't working or we're not liking it. So tell me a little bit more about that. Okay, so you're having some breakthrough bleeding. Okay, but how long have you been on this birth control? Okay, so you've been on it a while. And you said it's the pill, right? Perfect. Okay. So are you taking it regularly? Do you find that you skip a couple of days every now and then? Okay. So we skip a couple of days. That's totally normal. You know, trying to take a pill at the same time every day just doesn't always work for everybody. I know that I can't personally do it. I wake up at different times, go to bed at different times. Have you tried setting an alarm on your phone to kind of remind you when to take it? Yeah, still didn't work. That's okay. So there are lots of other options that we can do that aren't the pills. But let's talk a little bit more before we decide what we're gonna maybe switch to. Okay. So since you're taking the pill, I still want to kind of get some medical history. Do you have any history of blood clots? Anybody in your family have a history of blood clots? No. Okay, great. Do you smoke? No. Perfect. What caused you to get on the pill to begin with? Were you having problems with your period or were you just looking for birth control? Just birth control. Great. So let's talk a little bit about your period. On the pill, you said you're having some breakthrough bleeding, but how often or how long is that breakthrough bleeding lasting? A couple of days. Okay. So does it usually fall in the middle of your pill pack? Does it kind of tack on to the beginning or the end of your period, making your period really long? Just kind of all over the place. Okay. How heavy is your period? So you feel like it's pretty heavy. Okay. How often are you having to change your tampon or pad throughout the day? About 4 times a day. Okay. Is it a regular, super, ultra super? Regular. Okay. So changing about 4 times a day. What was your period like before you got on birth control? It was the same. Okay. Are you wanting to stay on a birth control that lets you have a period, or would you be open to a birth control that kind of eliminates that or makes it shorter or lighter? You're okay with getting rid of it? Okay, perfect. Some people, they like to have their period. They like to know when it's going to happen and just like that routine. And then some people like to get rid of it altogether. So I just like to know which side you fall on. Okay, so when did you start your period? Okay, so you're about 15? Perfect. So the next thing I like to talk about is just kind of like what your plan is, so I can kind of get a better idea of what options would work best for you. Are you married or dating, or you're dating? Okay. So when people are dating, I like to know, is it a serious relationship where you think that you'd want to get pregnant in the next couple of years? Are you, looking to not have a kid for, 10 years down the road, or okay, so you want to wait a while, about how long? Is that the 10 years or is that like 5 years? Okay, so about 5 years. That's great. So there are definitely a lot of options that we can utilize if you're not looking to get pregnant anytime soon. Now you're not breastfeeding or anything like that. No, never had any babies. Perfect. Okay, so there's definitely a lot of different options there. And if we're looking for something that that you can take every day, there are different options there. But if we're looking to eliminate what you're taking, and we're looking for maybe something that's like long acting, there are a couple of different options that, we would do here in the office, and you wouldn't have to think about it for a couple of months or a couple of years. So there are definitely a couple of options that we can explore there.